Hey everybody, welcome to my channel, Mental Health Importance. We all know that the world is in a state of emergency right now with the COVID-19 pandemic, but it seems like everyone has their heads in the sand, not talking about how this affects our mental health. Hi, I'm Matt, and I want to talk to you about something that no one else is talking about: the psychological effects on us as humans from this pandemic. Let's get started. COVID-19 has impacted the world so much, it is essential to consider how mental health may be affected. The pandemic can result in symptoms like anxiety and stress, leading someone into depression or worsening an existing condition for those who suffer from them already. The impacts of COVID-19 on global economies have had a detrimental effect on mental health, which can be seen with the number of adults reporting anxiety or depression during this time. In addition, a KFF health tracking poll from July 2020 also found that many people felt more anxious about their future because they could not afford childcare due to job loss. It is no surprise that the coronavirus has harmed many people's mental health. Research has shown an increase in alcohol consumption and substance abuse, difficulty sleeping caused by worry or stress over this pandemic, and worsened chronic conditions such as isolation from loved ones during periods where they may need help most urgently. Mental health and addiction are not new topics to be explored, but in the wake of COVID-19, many people have been forced to reevaluate their beliefs. The pandemic highlighted just how vulnerable we could all be when faced with difficult circumstances. Physically or mentally, young adults who lost jobs often experienced decreased self-esteem. At the same time, parents had difficulty providing for family members, mainly due to a lack of work hours at best, or even worse, job loss. Communities disproportionately impacted were racial minorities, along with those workers considered essential. This video explores these issues by examining recent data on mental illness before, during, and after this pandemic that caused mass panic worldwide. With all the stress from dealing with COVID-19, it's no wonder young adults are having a hard time. They've experienced many negative impacts, such as university closures and decreased income, things that possibly contribute to mental health problems in these times where there is so much uncertainty about what lies ahead. Higher rates of mental illness have always followed the economic downturn in the past. For example, people who experienced job loss were found to have worse symptoms than those without it, which is 53% versus 32%. This is especially true for adults living with their parents during pandemic times, where there was an increased risk due simply because they couldn't provide the necessary financial support. It's no secret that this pandemic has left many children without adequate care and education, but it seems like the strain may be more than they can handle, as research shows us an increase in mental health concerns for kids, as well as parents due to lack of educational opportunities or accessibility to child care services during these times. We also see students who are reporting significant challenges with school closures. One possible reason minority populations were hit harder may be partly because some organizations failed adequately to prepare themselves for emergencies, resulting from coexistent vulnerabilities. In the face of a pandemic, some essential workers continue to face challenges. For example, they're more likely than non-essential employees to report symptoms such as anxiety or depression, which is roughly 42% versus 30%. This is especially true for those who have experienced stress at work before and can indicate that their condition has been made worse by it. A more significant number also started using substances during this period, compared with other professions where there isn't usually much change in usage patterns over many years between surveys conducted on different occasions. The pandemic is affecting the physical health of our country and mental and emotional well-being as well. In this year, 2021, 41% of adults reported symptoms such as anxiety or depression. This number has been broadly stable since spring 2020. When it was 45%. A survey from June 2020 showed 13% had experienced stress due to coronavirus-related issues. 11% also mentioned thoughts about suicide recently in their lifetime. The current suicide rates are high, and they may even worsen due to COVID-19. Early 2020 data indicates that drug overdose deaths were particularly increased from March to May 2020, coinciding with a new lockdown at schools around some places. This lockdown led students into isolation until further notice because they could not be sure if their classmates had contracted or overexposed themselves during these months. It has been found that people with chronic illness have a higher chance of having mental health disorders, such as anxiety and depression. For example, 18% of COVID-19 patients were diagnosed with mood disorders after receiving the virus infection. This discovery demonstrates just how susceptible we all are when it comes to physical and psychological concerns during periods where our immune systems may be weaker than usual. The pandemic has left a lot of people feeling lonely and isolated, whether it's because they can't go outside or their friend circle has diminished due to the spread of this terrible disease. No one wants that kind of isolation in their life. We knew there were health consequences from all those missing social interactions. Research links them not just with poor mental, but physical well-being too. Young adults are struggling to cope with the immense weight of what has happened. Many have experienced anxiety, depression, and other mental health issues. Because many young people were unemployed or lost their jobs due to this pandemic. This situation caused them financial difficulties in life-changing ways that can't be undone now, even if they wanted to. Some research found one thing very concerning. More than over half reported having some psychological problems, such as feeling stressed out about daily tasks at home or work and having trouble sleeping. The pandemic has been devastating for young adults at high risk of poor mental health and substance use disorder before the coronavirus outbreak. However, many did not receive treatment as a result. 25% reported they started or increased their drug intake during last year's disaster, compared with 13% among all adults. Unemployment is a serious problem for many people, which can affect their mental health. For example, adults who lose their jobs during the pandemic are more likely to experience symptoms of anxiety and depression than those without an economic setback, which is 53% versus 32%, respectively. Similar to what was found in KFF studies tracking poll results, households who were losing money due to pandemic outbreaks were much more likely to report being stressed about coronavirus worries. Children are dealing with the effects of a pandemic that has led to many schools closing down. The closure is causing them inconvenience, but it also affects how they receive education in some cases, especially if virtual instruction replaces face-to-face time for any period longer than just this one recent outbreak. Research during these times highlighting concerns around poor mental health and well-being can be an issue for both children and their parents' experience, even more so now due to all the changes happening. It is always important to consider how mental health may be affected by a pandemic. Unfortunately, COVID-19 has impacted the world so much that it affects all of us, even those without symptoms or warnings of infection. The effects can range from anxiety and stress to depression for some who are already at risk for them. But there are ways you can help yourself stay mentally healthy amid this difficult time if they ever happen to surface in your life. Stay informed about new information on the virus and what's being done with treatment options by following news outlets like CNN, ABC News, and NBC News. Try not to dwell on death or dying thoughts. Maintain good relationships with friends and family, and keep regular exercise routines. Subscribe and turn on notifications so you don't miss more videos of the importance of mental health and much more. Check out other videos within the channel discussing a variety of mental health topics. Thanks for watching and take care.